all of the work that we do.
In this building, everything matters. And anyone that's been told they can't before they walk through these doors is told they can. At Association House, we are a vibrant, inclusive home for people on a journey to live their fullest life. From sunrise to twilight, our building is alive with possibility. Here, the structural barriers that exist in our city are removed, and people are supported to build the lives they envision for themselves. Together, we do the hard work. Here, we speak your language. Aquí hablamos tu idioma. Students reach for big goals and graduate. Adults find job training to build the career of their dreams. Parents are supported to be the best versions of themselves. People with intellectual and developmental disabilities find community and friendship. Mental health programs help our participants achieve anything they set their mind to. We create space for people to learn and grow. We foster belonging and opportunity in the community. We are leaders in high quality, interconnected, culturally responsive services. And we do it all with teamwork, laughter, a hug, dance breaks, and high fives. No challenge is too hard. No obstacle too great. We meet you with, we got this. We got you, grounded energy. Association House has been in Chicago for a century, and we will continue to be here as long as we are needed. We envision a future where each person is fully participating economically, politically, socially, and culturally in the life of their families, communities, and society. And we invite you to join us. Visit associationhouse.org for more information about joining our mission and vision for Chicago communities.
Thank you for watching. This is obviously not a conversation about everything that we do at Association House. That's just a little taste of who we are as an organization and the roots and approaches that we have in our community. Today's discussion is specifically about mental health in schools. Today's program is fairly short. Within the next hour, we are going to talk a little bit about the background of the How's About series. I'll introduce to you today's speakers, Ms. Tanya Wade and Ms. Claudia Loza, and they will go over the details of the overview of their work with providing mental health in schools, with the partnerships with the schools we are involved with. We'll lead an engagement practice together with your participation, so hopefully you're ready to collaborate. We'll talk about the stakes and the impact of mental health frameworks for student and child development. And lastly and not least, because of the fact that this is a truly community experience, everyone on this call is family. And if there are any things that are, if there's anything that you think of particular note that you're interested in, or things that resonate with you, we ask for you to leave commentary and questions for us to queue up in the chat, and we will read those during the Q&A portion. Starting off today, I'd love to introduce you to Ms. Tanya Wade. Tanya Wade is our clinical director, and she's been with us since 2013 in the capacity of clinical director since 2014, where she monitors program performance, provides clinical supervision and direction, and ensures participants receive high-quality clinical services and care. She is a licensed clinical social worker. Also, our second speaker today is Ms. Claudia Loza. She is one of three school-based counselors here brought on for this particular project. She recently graduated from Lawrence University with a Bachelor's of Arts degree in neuroscience. And she's currently attending DePaul University's clinical mental health counseling program to obtain her license as a licensed clinical professional counselor. She's passionate about trauma-informed care for BIPOC and LGBTQ youth. So I hand over the reins, I speak less now. I hand over the reins to both Tommy Wade and Ms. Claudia Loza for today's mental health in schools discussion.
Hi, everyone. Thank you for joining us. I really appreciate it. So today is just a little bit more information about my role and as well as the other two school-based counselors and what we're doing right now and aiming to do. So as Drew mentioned, we're in 3 different locations, 3 different schools that serve predominantly Black and Latinx students. And the students there are typically experiencing effects of different kinds of like poverty, housing insecurity, and sometimes they're even in situations where they're caretaker of their family or breadwinner of their family. And so they have real life events that they have to prioritize and that sometimes traditional schools don't exactly support. And so the schools that we're at try to meet the students where they're at to try to accommodate their needs. Because they're being challenged really early on without the tools that they need to develop in order to succeed. So they're often found steering a boat without a paddle. And so we're kind of there to help fill those gaps and hopefully provide education and awareness and promote that as well to be able to help destigmatize conversations around trauma and mental health and wellness and what exactly that means. And so we're there to support students with social and emotional development. We're also actively trying to make space for students and community stories because it's an active form of resistance for the things that they're experiencing. And so in doing that, we're also trying to support staff. For example, trying to promote wellness while working initiatives. This can look like maybe doing some mindfulness in the 5 or 10 minutes of their staff meetings that they have, or maybe having a conversation with them in the staff lounge of how myself or the other counselors can better support them throughout the day and what that can look like, acknowledging them and their efforts in the classroom. Because a lot of the time the work that they do is very normalized, but they also deserve to be acknowledged for the things that they do every day. We're also trying to build relationships between teachers, students, caregivers, and staff. A lot of the time, sometimes there's breaks in those relationships and we're trying to figure out how we can better build coalitions and encourage collaboration. We're also trying to essentially facilitate an ecosystem of care in hopes that we can create community, create great spaces and model that healing is possible. A lot of the times the students are going through things every day and they don't exactly think about healing when they're focused on survival. So it's really important that we kind of bring this to the forefront in our work as well and acknowledge that because it's a lot more complex than nuanced, especially in an educational space and setting. Sometimes we don't think about how everyday life impacts the lives of students, especially at such a young age when they themselves are young parents or have to work during normal school hours. And so they're only attending school for half a day and still trying to complete getting their diploma in time, things of that nature. So that's just a little bit about the work that we do currently.
I did want to add, if I could, hello, everybody, good morning. I wanted to kind of add, if I could, that, when we talk about this particular approach that we're taking through this grant, it is very intentional. We do a multi-tiered type of intervention with the students and the teachers and the parents in some way, where we're trying to, again, as Claudia was saying, kind of collaborate and make systems where we can. Because when we think about just education in itself, I don't think there's any universal practice in terms of how to bring these things to the school. You have different locales, you have different regions and districts doing different things. Different schools and districts have different resources. So it's nothing universal out there. So this particular project is really taking a look at what can we universally do? What universal language can we put into place? What universal types of interventions and social emotional learning can we put into place to kind of assist the teachers, right, with that common language? That helps the students and also helps the parents in some capacity who know their kids very, very well. So in a way, again, this is a great way of doing something that's very intentional and that's actually funded very well as well.
No, thank you for that note, Tanya, and thank you, Claudia, for giving us a little bit of an overview of this particular initiative that we have. It's, as we move into the next area of our discussion, I think it's really important that, Tanya, you mentioned that there is no universal language, that there is no universal practice, and taking into consideration the limitations of very many of our school systems to provide mental health resources and that access, that broad access. How does one, a professional, mental health professional, really center the engagement? That is what we will be doing today with a little exercise. Again, note for everyone that's on the call, we are going to be asking a little bit of you today. So as we introduce the song engagement practice that Claudia will talk a little bit more of in just a second, I ask that you put any information that you feel that you can share into the chat for everyone.
Thanks, Drew. In the next part of this presentation, I'd like for everyone to think of 3 songs that you feel like best describes you, or maybe that inspires you when you think about yourself. So 3 songs that you believe best describe you or that inspire you. And as Drew said, please feel free to drop them in the chat, or if you feel comfortable sharing with the group, that would be great as well.
And as we're waiting for a couple of those, Claudia, I wanted to ask you, I'll put you on the spot, but this is a way to center a conversation. This is a way to center a conversation with individuals. These are students, by the way. These are high school students who many times are willing to share on the spot, but at other times might need to feel a little bit more trust and safety, might need to know you a little bit more. Can you tell me, as an approach, just higher order, how this interaction kind of satisfies some of the people who are a little bit more reticent?
Yeah, great question. Yeah, so the process of care, I feel like, requires trust and safety. And so in order to help build that rapport and build those relationships, we have to be able to create and establish trust amongst the students. So during my time at the school, last school year, I noticed that the students were very, very into music. They loved listening to it during class, in the hallway, anytime they could, they were trying to listen to music or watching like YouTube videos or like music videos. So I realized early on that that was a good way to get to know them. And I began to ask them about like 10 songs that they believed told me about their life, or what were like the 2 top songs that they were listening to right now, or their favorite artist at the moment. And that was a way to begin to develop conversation and relationships to help bridge that gap and create that trust and give them a sense of safety as well, so that they got to know me better, I got to know them better. And it's also a really great segue into getting to know more about some of the things that they're experiencing and going through, and how they see themselves in the music and how it speaks to a sort of soundtrack to their lives, and how it gives voice to some of the things that they don't necessarily know how to express yet or are trying to figure out how to express. So it was a really great tool to utilize in continuing to build relationships with them.
As people are putting some of their, goodness, come on, myself. As people are putting some of their songs into the chat right now, to give food for thought, or fodder, what are some of the songs that you've heard some of your students give you during this season? Just one or two.
Yeah, I think in general, a genre that's very popular with them is rap. They're very into rap music, speaking about, in particular, some themes of trauma, violence, PTSD, how they've seen that affect their own lives, their friends. A lot of the language that I've heard used is how they're very numb to it, to opening up conversations to what that means and what that can look like. And also how that manifests in their behaviors, and how it shows up.
We are receiving a couple, and I'm going to pick out one. I hope that you would be willing to participate, Kendall, in this practice. I'm reading that you have 3 on hand. I'm still standing. 100 years, 5 for fighting. And how do you feel?
Kendall, and if I can ask, if you can choose one of those to tell me a little bit more about why did you choose it?
Kendall, if you feel interested in participating.
So I like 100 years because I feel like it shows you, like, I guess, like the different like evolutions that people kind of go through in their life, and like not to, I guess, like to take things for granted as they're happening, because you really only have so much to make your life. I don't know, that song's kind of just been on repeat for a while in my head, so I put it.
Yeah, thank you. I appreciate that. I'm also hearing how that sounds like that's something that resonates with you and is important to you. Just how you have like a little time left and being able to appreciate the time that you do have here. Juan Carlos says Tupac, Lord Knows, or anything by Bad Bunny. My Shot, Neil Hamilton soundtrack. These are all great choices.
If I may ask you, as you're engaging in this practice with students, I remember you telling me offline a little while ago that there's these aha moments, that there's an aha moment that you have when you're engaging in counseling with this particular practice in your wheelhouse. How is it for some of your students to break through? Might be a difficult word to use, and I apologize if it's not fitting, but to use this and then lean into this practice as well. How does this help them to break through with you?
Yeah, what you're getting at essentially is that moment of like self-awareness that they kind of are starting to develop and lean into. And I would say I've seen a range of responses, from emotional to more so processing and trying to make sense of it. And even in between there's a lot of other responses, but yeah, I would say emotional, because they're also realizing for them, like, the puzzle pieces are starting to fit into place, so to speak, and for them to finally have access to language that helps them better describe what they're feeling, what they're going through, is very cathartic for them, and it's also very empowering. When you're able to put a name or be able to describe something that for so long has impacted you or affected you, it can be a very empowering experience. And it's also something that doesn't happen overnight, right? It's a process. It takes time. It continues to take trust and rapport building. And it's something that you definitely have to be committed to. And so I think that that's why it's really important that myself and like the other two counselors are doing the work that we do, because a lot of the time, teachers don't necessarily have the space to do that. Of course, they would love to in a classroom because they see how what the students are experiencing is impacting behavior in the classroom or classroom management. But classrooms aren't necessarily set up in that way to always make space for that. So it helps to have a deliberate space and actively be creating a time to, pull a student to the side and be like, hey, let's check in today. Be able to check back in about how they're doing or what's going on, or be able to ask about grades or how they've been feeling, or maybe you're noticing that they're a little more tired today. So how can we accommodate them and meet them where they're at?
I appreciate that. Thank you for elaborating on this particular exercise as one of many in terms of the approaches that you take to provide that accessibility, to build trust with students, and to lead as a participant, a co-participant with them in exploring the development of their social and emotional health. I think that Kendall, because this is very participatory, I want to thank you as well for sharing, and for everyone for sharing your songs of choice. There is the notion that practices like this, and I go back to Tanya's comment, the integrated approach that we have to create this ecosystem when there's no universal footprint, that not every school has the resources at all, and that we're lucky enough to be able to collaborate with our grant funder to provide this opportunity with the students that we have. I wanted to move into the next part of our discussion. We're happy to have you, Noam. Have a good day too. We are, as we move into the next part of our discussion about the stakes, when we move into the next part of our discussion about what is the impact when we collaboratively make this ecosystem, when we provide this broad access opportunity for students, what does happen for them and the parents in the school and the community, and also what happens, what do we see, and what does research show when there is that broad access failure? May I have you and Tanya speak a little bit more about that?
Sure. Yeah, of course. So, I think, again, what I was mentioning earlier is that there has to be some type of intentional and focused universal approach to this particular process, because there are disparities in services and supports and things like that. So, interestingly enough, there's a stat out there that says that just as many kids are getting resources or therapy, if you will, outside as those who get it inside. So if we kind of have this universal way of kids having that access in schools where they're at for like 6 hours plus a day, then that would be very helpful for a lot of the students. There's also the promotion of just health and mental health wellness, which also improves academic outcomes. I mean, when you think about it too, I think about a school day, you think about maybe a student who's not having a great day or hasn't had many, many great days or months. They come into a school, they might be in a foul mood or bad mood, and they might be very verbal towards a teacher, not doing their work, that type of thing. And in the past, what a teacher might do is maybe send them out of the classroom and say, go to the principal's office, you're going to get detention, or yet we're going to expel you because of your behavior. In this way, there's a common language that someone like Claudia can tell and say to a teacher or principal or school personnel, listen, let's look at some trauma-informed ways and practices and languages in relation to how to speak to the student, how to teach the student, so that their outcomes are not where, you know, we see on this list in terms of truancy and dropout, school violence. So let's take it from here, right? So then you have a student who's not doing well, and they're in and out of school. Maybe they've been expelled, or they have a lot of suspensions, so they're not getting what they need, which leads to poor academic performance. Sometimes there's bias there by the teacher. If you're giving a teacher a hard time, the teacher's not prone to wanting to necessarily work with you a lot of times. Sometimes they might have their own, like I said, own biases and their own way of interacting with the student that's not in the best interest of either one of them. So it increases the behavioral problems that you see in the classroom setting, for example. When we talk about some of the untreated or undertreated diagnosis that a lot of our students may or may not have, symptomology like depression, things like that. It can lead to sometimes eating more or some disordered eating patterns or eating less. So again, there might be some fluctuations or drop-offs in weights or weight changes. Maladaptive coping skills, we see that all the time. I think in one particular school, you know, we had a lot of students, unfortunately, maybe fighting one another, not just being able to cope basically in any kind of healthy way. And so you see that in the schools as well. Maybe substance abuse. And all these are risks. These are not things that are on this particular list or things that are going to happen because you don't have this particular thing in place. But these are the stakes. These are the risks that may or may not appear. So you might have some students, of course, that are masking and numbing with substances. We talked about the truancy and dropout rates. You know, if they're not getting what they need in a lot of places, whether it be home, become the school, which is supposed to be a safe haven, you know, it's pretty much structured, and you're not necessarily getting that. They might find other opportunities outside of the community where they're dropping out or trying to get the things that they need out in the community, and not finishing their high school careers or academic careers. And then we talk about suicidality, the attempts, and we've heard a lot about that with students, unfortunately, you know, whether it be something that's happening in a school, something that's happening within their communities, something that's happening within their homes, and no one's catching it necessarily, or they're not catching it on time, or they don't know the signs to look for, or the right questions to ask. So you might see some attempts or some successes. And lastly, I talk about school violence, and you know, we've had a lot of school violence and things that are happening in the communities and across the state regarding shootings and things like that, which are not synonymous to what we're talking about in some ways. I think a lot of times we talk about those things that are on the news, are sensationalized, and we'll get to that a little later. But we talk about school violence, just how do I, as a student, approach someone else? If I'm having a hard day, if I don't have the verbal skills maybe, or just the emotional IQ to kind of talk about how I'm feeling, sometimes people act them out. And that leads to school violence between peers, sometimes unfortunately between a student and a teacher. And when you have particular programs that we have in place now that Claudia and the rest of the team are working towards, you reduce that in a lot of ways. Because again, everybody's speaking the same language. Teachers have the tools that they need to kind of address these students and help these students through. You know, you have the parent leadership as well, who know their students, like I said, also who can come in and say, this is what I see, this is how the school can help. And it all works together to improve these academic outcomes and improve the kids' lives and family lives. If you can really impact a student in that one way, and it seems like a very small way, but it really isn't, this is a huge deal right now, then you'll impact a full generation of people.
Please. I'm sorry, I didn't want to cut you off.
Oh, no, go ahead. Sure.
Tanya, I'm struck by, in a very positive way, I'm struck by how, I keep going back to what was originally stated about ecosystem. And what you're now talking about is that what we see on the screen are risks. They're corollary. They can happen. This is a sphere of influence. Students are in schools for up to 8 hours a day. And when they are there, and when they are feeling a number of life's events and stressors, and they're taking that on, and they have up to a number of different ways to either keep calm and steady and carry on, or the other opportunities that are at their disposal. I want to move out for just a second and just ask this question on behalf of the audience. Association House has been doing work like this. We've been doing behavioral health, and we've been connecting with schools in a number of different ways for very many years. With this particular initiative, as we talk about the stakes, as why it's so valid to have this framework in the school, can you tell me how was the process of transitioning into an integrated daily resource for students and parents and teachers?
Yeah, in terms of our initiative, I know Claudia can probably speak to her experience, but I think the way that it started, it was quite difficult in some ways, because you have a framework for some of this, and you have a desire for this, right? A lot of schools are very open, and the people we've partnered with, or the schools we've partnered with, were very open to having these types of resources in their schools. The way that we came in was kind of in the middle of the school year, so it's quite difficult because, as you know, and I don't know if there's any teachers on the call, that there are administrators, there are a lot of things schools have to do, right? There's some federal mandates, the academic achievement is important, and the reading, writing, and arithmetic is important. And they struggle with some of the volume of kids who are in need with what they have in there already. So us coming in, it's like, wow, it's probably a breath of fresh air. It's like someone else is going to come in and give us some tools and provide some services to our kids, because it really is, it's about the services, yes, some of the individualized kind of interventions that Claudia and the team are doing with students, but it's really about what is the framework we can give, and the ecosystems and the infrastructure we can give to the teachers and personnel to have that common language and to speak the same language and to engage with the students in a way that's not going to set them up any larger. So they're kind of all on the same page. So they've been very welcoming. There have been some hits and misses, right? And I think that this school year, Claudia and the rest of the team have a good plan in how to kind of address those particular issues. I don't know, Claudia, if you want to say more about that.
Yeah, and you spoke a lot about language, and something I immediately thought about as an example of that is a lot of the time we talk about like strength-based language versus deficit-based language, and giving the staff access to that, what exactly that means. So for example, when you hear the labeling of good student versus bad student, or if someone isn't turning homework in on time, it's like, oh, they're lazy, right? So that would be an example of like deficit-based language, versus strength-based language is like, okay, what are the strengths of this student, right? Are they very good in one particular area, right, math or English or whatever the case may be, or are they very motivated about a certain thing, or right? So how do we play off of the strengths that they already have to be able to build off of those so that they can succeed in the classroom and outside of the classroom, as well as giving parents and teachers some training or information regarding trauma-informed care, as Tanya mentioned. Some schools don't have this, some schools don't know what that means, right? They're not familiar with the language, and so that's where we would come in. And I think it's a huge privilege to be able to have access to an organization like Association House, because then I can, get in contact with Tanya and ask for us to outsource somebody to help me maybe run a training about trauma-informed care, and how that affects classroom management, or what are some resources I can provide the teachers regarding trauma-informed care after the training that I give. So it's all pieces and parts of essentially like wraparound services that we're trying to to give, and it definitely hasn't been easy. I know in particular, the parent engagement or the caregiver engagement area has been pretty tough. And that's also been because a lot of our students don't come from neutral families. Some students are their own caretakers or guardians. Some students are being taken care of by family friends or extended family. Every situation is different. So that has been an area that's been a little bit more challenging for the team and myself. We're trying to figure out and come up with creative ways to do that. And we're also very understanding of the circumstances of caregivers regarding work or other circumstances. Maybe they don't have childcare to be able to take some time out of their day, or they're working second and third shift, or whatever the case may be. We definitely understand that those things also impact engagement. And so we're trying to find ways to, again, brainstorm and collaborate. Do we send out newsletters, or is there a better time to run a certain meeting? Or so just trying to come up with more ideas of how to effectively do that, because it takes a village. And if we're trying to create an ecosystem, we can't just have two areas running very well. It all has to flow very well together. And that takes time and effort, definitely.
Thank you, Claudia. Thank you, Tanya, both for entertaining me on behalf of the audience and talking a little bit more about the functional development, how our approach is working and how it can continue to develop. I know that I have a lot of questions. I don't want to speak on behalf of the audience. As we move into the next portion of our discussion, which is the question and answer, I wanted to take just a quick moment and relate some of the participant concerns that I've been fortunate enough to get on the front end of this particular How's About presentation. With the number of registered guests that came on, there was a question that was sent out, and I'm very happy that everyone that is participating today helped in some way to contribute to what I'm able to compile. I won't read everything that's on the screen, but in terms of participant concerns, as we introduce questions and answers, many are from the healthcare or education fields. Many people also expressed that we live in a real world, and many of the things that we happen to be seeing nowadays are sensationalizing, trauma. We are seeing an uptick in school shootings. We're seeing the impacts of social media access on social and emotional development and outcomes for children. As one person put it, mental health for youth, this very topic that we're discussing today should be of concern for all Americans in an uncertain world. I would be remiss if we're talking about an approach here in the city of Chicago with this organization partnering with 3 schools and not understand that this itself lives within an ecosystem where so much is going on that so many people have so much interest in learning more about. And so I leave this for everyone that's on the call to consider asking you and Tanya any question or concern that they have based on, one, what you've heard today about the stakes, about the outcomes, about our approaches, or anything else that resonated with you today regarding your experience. I can read what you're putting into the chat. So I leave a couple of moments for you to start thinking about questions. I invite you to share. Maybe as we move into the section, I'm waiting for responses, I can ask Tanya and Claudia, are there any kind of final thoughts on some of the things that you were talking about throughout this presentation today?
Yeah, no, I think about, what can a person do? right? Because there's a lot of, I think, micro, macro, and meso levels of this particular thing. You know, I have the legislation, which we talk about. What does it look like for policy, right? In some of these. And I believe, if I'm not mistaken, I don't know, it's Pritzker. I know like last year, Pritzker put in 5 mental health days that students can take. Right, that's one thing that he did last year. I believe there's some initiatives here in Illinois that lead to increasing the amount of school-based counselors that are in schools, right? And so there are some initiatives happening that people are trying to do. Again, it needs to be universal, but what does that look like for the voter, right? What does that look like for you as advocates? You know, we talk about sometimes how do we sustain funding, right? So this is a 2.5-year initiative that we have now, but at some point we're going to have to sustain it. And it costs to do that. So, you know, sometimes I say, what can people do, right? They can advocate to their local legislation, you know, in terms of what these policies look like. So there is more state funding to pay people like Claudia and for us to have supplies and the infrastructure and create this ecosystem, right? There's just things you can do on a very micro level in terms of engaging with your own child or student or someone that you know, because a lot of this has to do with engagement. A lot of people are feeling so isolated and they're managing so many emotions, whether it be anxiety or depression, and are we engaging with them as readily as we can, even if it's playing a card game? You know, we just talked about social media and being online all the time, and people get proliferated with all of that, and you're like over and inundated with that, all this information. Well, how about just having a conversation or playing a game of cards or something like that with someone to see where they are and to just check in with them. And then there's, you know, the good work that we do here, right? And so how do we contribute to some of the things that we do here in terms of, you know, whether it be supplies, whether it be some needs that an organization might have to continue this good work. It all helps. So no matter what track you choose to take, again, you are affecting maybe an individual, but that individual, you're affecting them probably generationally because you're changing one life at least.
Thank you, Tanya. We do have a question from the group. Let me read one from Word, excuse me. How are we continuing to see the pandemic affecting student mental health?
I think I can take that one. I would say, first and foremost, definitely anxiety still surrounding getting COVID, how that would impact their daily lives. As I said before, some students are breadwinners in their family, they work full time. And so a lot of the time it's having to think about, well, I can't afford to take, you know, even a week off, a couple of days off. How would it impact them then? Getting behind on schoolwork. Also some sensory things that we don't always think about, but like having the mask and how that affects some students in order to be able to like express themselves and how, you know, they utilize facial expressions and, you know, bodily expressions. And then also a big one has been COVID fatigue. It was a lot for the students to have to sit in front of the screen all day and then having to come back to the classroom and get back into the routine of, some of the students travel very far to go to the schools that they go to. And so that has also been pretty tough. And I think on the end of the teachers is also trying to meet those needs of the students and meet them where they're at. It's very tough. Right, they're also trying to teach a curriculum, and so when you have students that are all in different places, trying to again apply something universal can be really hard. So I think those have been some of the things definitely that we've seen still impacting the students.
Thank you, Claudia. This question comes from Noah Salata. This work is so powerful for students. Any intentional actions around supporting the actual school-based counselors and frontline workers in this project?
Yeah, that's a great question. I think as far as frontline workers, I would definitely also consider teachers a part of that. So trying to figure out how to effectively cope with things like burnout especially has been very real in the last school year, and trying to come up with ways to support teachers in and out of the classroom. Does that mean sitting in a class and helping students regulate who are having a more difficult time regulating and are, disrupting a lecture? Or does it mean, letting a teacher take a 5 to 10 minute break while they use the restroom? Or again, it's trying to come up with creative ways to deal with very real life events and effects. We don't necessarily have all the answers. We're doing the best that we can. And I also think being very transparent about our own needs and our own experiences, being able to have that relationship with Tanya where I can, come to her and tell her, hey, I'm really exhausted right now, or I'm out of ideas, has been very paramount and important. And we have to have that relationship because, right, I'm also a part of that ecosystem. So if I'm trying to give from an empty cup, then things are not going to be able to flow in the motion that we would hope for them to. And so I think also building that relationship with the team and myself has been very integral. And at some points it has gotten to that point where we're out of ideas, or we're just trying to do the best that we can. And saying, hey, at least we tried, and that's the only thing that we can do, because we know we're not going to have all the answers, but we also need to take care of ourselves.
And interestingly enough, I think when we talk about, again, on a micro level, to the question in terms of what intentional activities, right, that you've done, it might be about sprucing up the teacher's lounge, right, adding some great treats in there for them, or some type of little goodie bag in there for them. I think at one point we thought about providing some type of respite. So for example, I know every classroom, and please, the language I might not have, we used to call it homeroom back in the day, but you have this period where you're not teaching necessarily. Can Claudia and her team, or can somebody come in and just provide respite for that and teach something really quickly, or lead a really quick group on I don't know, meditative breathing or something like that, or coping or something like that. So it really is I think a very, I keep saying it, intentional way of how can we support the school-based counselors and the other frontline workers in what way. And even if it's in a very simple way, to take them away from what's happening within the classroom, or having some skills, or talking with them, or connecting with them in that way. That's what that program looks like too.
I appreciate your responses. I appreciate the question as well. Noah, thank you. Noah, thank you, Lillian. If there are any other questions, I invite people to share. If they don't feel comfortable sharing to everyone, they can send it directly to me, and I can read it anonymously on their behalf as well. But in the moments that I wait for that, and as we begin to close, I ask, oh, Andrea, did you have a question? Oh, I'm reading the screen wrong, I'm sorry. But in the moments that we have left, I will do my best to synthesize a little bit of what we've just been talking about. And Claudia, in my engagement with you, you've always been one that you're a sage. You had this really wonderful image of, how can I give if I'm trying to give from an empty cup? And to me, that reminds me of what you said earlier. The idea of the ecosystem is that we're trying to do intentional activity to create a process inside of a framework that doesn't exist, that is not universal. And so being able to understand the potential and the heroism of your can-do attitude, right, coupled with us being experts in our field and community, mental and behavioral health, understanding the bumps in the road and understanding that this is a functional and evolutionary practice, it's a lot to explore. The issue here is that it's a lot to explore within a framework that doesn't exist. where resources are customarily very few, and that there's also an uphill battle to validate and amplify the voice of mental health need access for anyone, not least of which are developing young minds or developing young students. So as I continue to look for questions, I just want to let you know that this conversation isn't over. On the screen now, later this month on Thursday, August 18th, one of our community health experts will be having a conversation facilitated with WBEZ Chicago. So I hope that you'll have an opportunity to engage with that. We as an organization, in terms of community health, also lead frequent in-person mental health first aid trainings. So, and I'm going to borrow the language that Tanya shared, if on a micro level or a meso level, you are interested in wanting to learn about identifying symptoms or identifying behaviors that are indicative or suggestive of a mental health crisis, that you sign up for one of our mental health first aid presentations and workshops. We lead this with school groups. We lead this with paraprofessionals. We lead this workshop as well with laypersons across multiple industries. So even if you're not affiliated with healthcare, even if you're not affiliated with education, but you really just want to empower yourself as a true empath to be a little bit more accessible individually with identifying and attending to and resource sharing with individuals who might be experiencing a mental health crisis, I implore you to consider joining one of those upcoming workshops. I don't see any more questions. So I do hope that everyone who is participating today had an opportunity to really walk away with something about this topic that then you can carry further into your lives, that it was something that resonated with you, and that it was something that, again, you as a supporter of Association House can take with you and feel even more empowered to know that there's community action happening on the ground that is both informed by evidence, informed by trauma, informed by care for individuals who need access and who otherwise don't receive it. We're doing good work in our community. As we close, I just want to thank you and everyone on the call once again for joining us today, for being a part of this discussion, for helping to validate and amplify the voice of mental health, not only in schools, but mental health is a platform that we should be taking in our society a lot more seriously. With that, I thank you all so much. We are at 12 p.m. I hope that everyone has a good lunch and a good rest of your day. A couple of individuals have asked if this recording will be made available. It will. So look for that in the days to come. And if in the meantime you have any other questions or concerns that you didn't share now, but do feel interested in sharing to continue the conversation, we are all available. You know where we are. So I'll send out an email just to thank you once again, and then you'll have a direct line with us all to continue the conversation. But with that, I'm hoping to be the best cheerleader possible. Thank you all. Thank you, Tanya. Thank you, Claudia, for leading this discussion. Thank you both for the work that you do with your expertise and the compassion that you have on a topic that really does deserve a lot more recognition. And then thank you all for joining. I hope you have a good day.